Now, you had mentioned workaholic. How does one know that they're a workaholic as opposed to just a hard worker?
It's very unique to the person. A lot of men will come in and say, well, I just love to work. And that's probably true. They do love to work. But what we really have to look at is what is the impact on their social, emotional, family functioning? Some people are able to work 8 hours a week, but they have very solid self-care plans in place. They are very connected. They're not using substances. So there's ways to manage that. So it's not necessarily about finding a number, finding like 35 hours or 45 hours. It's about finding the unique, kind of self-care and counterbalancing that can happen. I mean, finding a number of work is important, but there's so much more to it to figure out what that line is for workaholism and ways to back that off. Because once it's workaholism, it's the same as drug addiction, gambling, sex addiction, all these different addictions where it's, you're doing the same thing over and over and expecting a different result.
Now, you had mentioned all these different kinds of addictions, and I think it's important to also have a term for that. We term it process addictions, and you work a lot with that. It's not just taking a substance or alcohol. It can be the gambling, the sex, the acting out, anything to deal with their stress levels.
Yeah, absolutely. I mean, this is one way that men will typically try and cope. They'll try and engage in the substance addictions, which could be the drugs and alcohol. And like you said, the process addictions, they're engaging in a process, a ritualistic, obsessive, compulsive process that's really stimulating the dopamine in their mind, and it's giving them a bit of a thrill. And it's actually an avoidance strategy. So these process addictions allow them to avoid feelings, thoughts, issues, experiences for a short amount of time, but with consequence. But they're actually getting a thrill. So you would think, process addictions, they're not taking anything. Could that really be an addiction? But they're finding like the brain will light up just the same. When people have MRIs, they can really see like what's happening in the person's mind when they're actually thinking about acting out or they're thinking about getting involved in the ritual. They're lighting up just like the brain's lighting up just like it would with cocaine. So what's happening is they're really using these process and these substance addictions to cope and to regulate emotions that they just don't have the skills for.
Well, I'm glad you're speaking to that because I think there's a lot of shame surrounding those, and people often don't see it as a problem. I see it because I work a lot with couples, and it often pops up in the relationship. So I'm glad you're speaking to that today. Could you let us know where we can get in touch with you if anybody has any questions?
My office website is protzeltherapy.com.
Okay.
And all my contact info is there, so I'd be happy to talk to anybody or consult regarding men's issues.
Okay. Thanks so much, Dr. Protzel.
Thank you so much for having me, Laura.
And thanks for joining us today.